Let's now bring in the Acting Director General of the Department of Health, Dr. Nicholas Crisp. A very good afternoon to you, Dr. Crisp. Thanks very much for being with us here on SABC News this afternoon.
Afternoon, Claire, and thanks very much. Just to clarify, I'm not Acting Director General. I'm the Deputy Director General in the department. Thank you.
All right, well, we'll give you an upgrade there. All right, let's start off by talking about, let's talk more rather on the issue of South Africa receiving or going to receive technology to produce mRNA vaccines. The public would obviously want to know more about that. What's that about? What would that entail? And also just how it would help us in the fight against COVID-19 here in South Africa.
Yeah, thanks very much, and thank you for the question and for having us on.
Sure.
Look, South Africa has got unbelievable technological capabilities, particularly in the area of virology, immunology, and vaccines. Because we've been fighting against the HIV epidemic in this country for so long, the capabilities in the research and development in this environment is huge. Mm-hmm. The health department and a number of other health-related institutions work very closely with the Department of Science and Innovation, Department of Higher Education and higher education institutions, together with others across the world to develop diagnostics and treatment capabilities in this field. So we have amongst the world's best capabilities. And what has happened now is the WHO has recognized that the country has these capabilities. We have scientists and other technologists who work across these departments and institutions and universities who have now been brought together into this technology hub. Yeah. And as I said, we work with other departments. So this is actually a project of the Department of Science and Innovation. And they have now succeeded in using the publicly available information to create a new mRNA vaccine that is not it's not a copycat mRNA vaccine. As far as we understand what's been described to us by those working on it, it's a new vaccine. Yeah. This is really good news for Africa, and it's really good news for the developing world, because it means that we are able to be self-sufficient going forward. mRNA vaccines have been under development for many years as a vehicle for dealing with a number of diseases. And once we have this capability, we will be able to protect ourselves in this country, other countries on the spokes of, as the president spoke about, rolling out this technology to other parts of Africa and to other countries. So it puts us in a far stronger position to deal with these kinds of epidemics and pandemic diseases which are going to come.
Yeah. Dr. Crisp, then, my question then is, why are these organizations, these global organizations, I'll give the example of WHO, only recognizing now that South Africa was miles ahead to begin with? Why were we not given the go-ahead to develop our own vaccines in the first place, or when the pandemic in fact started? And from where I'm sitting, would think, is it because, we're on this continent, we're in Africa, so our capabilities were perhaps doubted? Why are they only being picked up now?
No, they've been picked up right from the beginning. The WHO knows exactly what South Africa is capable of, and the Director General is a strong friend of this country. We are very familiar, we work very closely with the WHO, the country representative, the regional representative here in Africa. We are very close to what they do, and they support us in many areas. And they have been supporting us in field epidemiology during the whole epidemic. But the development of manufacturing of vaccines is not a simple process. It is something that takes time, and it needs a critical mass of action and investment. Vaccines were only really available. In fact, it's 1 year ago today, since we vaccinated the first person in South Africa, so on the vaccination program. So it's a relatively new thing. It's been under development for some time, and setting up these hubs has been going on for months. And the development of the capabilities at Afrigen, amongst others, and of course, I think we all know that the Aspen plant is doing the filling and finishing of the Johnson & Johnson vaccine, has been active right from the beginning. The WHO is well aware of that. They know that. They have worked with us. We are not a Johnny-come-lately, and it's just that it's really in the public eye at the moment. And we're incredibly grateful that we are getting really the recognition which we deserve and the support which we need.
Yeah. Doctor, let's talk about, or rather, if you can perhaps give us an indication or update on how the vaccination program is going in South Africa. And, I'd also like to, on the back of that, talk about the Omicron variant and the sub-variant. How has hospital admissions been? And maybe we can talk about since, let's say, December.
Okay, so in terms of the vaccination program, we were doing pretty well until just before the start of the Omicron variant and Christmas, and everybody getting quite fed up with being confined to spaces, burnout from just months and months of more of the same. So I think we recognize that through the month of December and January and now into February, we really have not had a very productive vaccination program.
Yeah.
We are on around about 30.8 million doses as of today. And as we heard the Deputy Minister say just now, 17 million adults have been vaccinated so far. But we are only vaccinating between 65 and 70,000 per day at the moment. So you'll see I'm wearing here today.
Yeah.
We've had a big launch function together with the Department of Higher Education and Higher Health at one of the TVET colleges here in Tshwane today. Very successful event. Now, this is an event that's been organized largely by young people, and it is for young people, and we are extremely grateful for the energy that they have put into this program. So we will continue to vaccinate older people who are at highest risk, but we do know that if we don't get everybody vaccinated and we don't get a significant portion of the population vaccinated, we make ourselves more and more vulnerable to more variants and more waves of the illness. So we know that the pattern up to now has been that we get 2 waves a year. So we expect that there would be another wave sometime around about May, June. We don't have any way of telling what that variant might do. We do have a variant that we understand well at the moment, and it has behaved completely differently from the 3 previous variants that created waves in this country. Mm-hmm. This Omicron variant has got a primary, and then it's got 2 other subvariants, of which one is now taking over from the original variant. But the good news is that it's not behaving very differently. It's just got a different sequence on the genetic makeup of this particular virus, but it is not behaving differently. So, and it is responding in the same way to our current community immunity, both from vaccination, which appears to be a much longer lasting and better immunity, and from vaccination from wild infection.
Yeah.
So I think what we need to understand as a community and as South Africans is that COVID is far from over. We must not let our guard down. And if we want to protect ourselves as society, we need to get out there. We need to get our lives back. And the quickest and smartest way to do it is get as many people as possible are vaccinated as quickly as is possible, so that we don't get these strange variants taking over our lives again.
Now, you were talking about people being fatigued, from being locked in and, having to adhere to the COVID protocols. But I'd like to bring in something else, which is maybe I'll coin a new phrase here in terms of, vaccine fatigue, because, we do understand, and you were mentioning, this time last year, the first batch of people were getting vaccinated, and now those people would obviously then be due for booster shots and so forth. But, if I look at, people who have been double vaxxed, for example, there are some who are not particularly keen on the booster shots, and I wonder if that's been a wide-ranging or just a small group of those that have been double vaxxed that aren't particularly keen to get the booster shots, or does it seem to you that people are indeed suffering from vaccine fatigue?
Yeah, look, I think we know that there's a wide spectrum. We have various people who are doing research and telling us what's going on, so that we're able to tailor make what we do from the health department's perspective.
Yeah.
This is not a health department's problem. This is a society's problem. This is you and me and every other person in South Africa who who wants to be protected and get on with our lives. We want to be able to travel and party and love our families and do that what we did before. And so we are all a little irritable, and we are all a little bit fatigued about having to wear masks and having to go and get vaccinated and so forth. But we need to understand what a vaccine is and what we are trying to achieve with it. A vaccine is a protein or an mRNA vaccine that makes a protein in our bodies that pretends to be the virus. And then when we are exposed to the virus, our bodies have made an immune response because they have been exposed to this lookalike.
Yeah.
So vaccines are modified versions of what we will get exposed to with a protein. And the more we get exposed to that, I mean, we are used to vaccines. We've all been vaccinated against polio and measles and tetanus and whooping cough. And many of these diseases we don't see at all anymore. Some of us still recall, and I as a doctor have treated patients with many of those diseases over the years, where my younger colleagues don't even see them anymore.
Yeah.
And that's what vaccines do. So we really need to get over ourselves, and we need to understand a little bit more about what's expected. And boosters, I'm afraid, are required for the long term to get our cellular immunity to respond and fight against this COVID.
All right, Dr. Nicholas Crisp, thank you for giving us your time. And let me get it right this time, Deputy DG at the Department of Health. Thank you, sir.
Thank you.